Hello, I'm Molly McDonald, and I am doing my infectious disease project on syphilis, or Tripodium pallidum. So as you can see, here's a picture of syphilis right there. It is a spiral organism. First, we're going to get started with what syphilis is. So syphilis is actually a pathogenic, slow-growing bacteria. So it's actually very weak outside the body. If you mess with the temperature, the environment, it's going to die very easily. It is spread by contact. So when we mean contact, we can mean areas that have poor hygiene. So third world countries that kind of live on top of each other, aren't bathing well, things like that. And also, it is spread by also sexual contact as well, and from mom to baby. So this is actually a really prevalent sexual transmitted disease in third world countries and in America. Actually, 36 million cases worldwide were established, and about 11 million new are diagnosed each year. So if we get into kind of some of the pictures of what syphilis looks like, so these are all in the mouth. No good spot for this. So signs and symptoms, and this is the primary stage. So there are 3 stages here. So you have, this is the primary stage. So you're going to have this like breakout of ulcer, and it's usually going to happen between 4 weeks after contact, but it can take up to 90 days. So this is one that can go into the system and then just lay dormant. So this stage is going to last from 2 to 6 weeks. It's highly infectious. So that ulcers that you see on the tongue, around the mouth, so these are, if anybody comes in contact, it's spreading. And so through these ulcers are actually where the bacteria enters the body. And this can be mouth, genitals, or the rectum. The second stages of syphilis, you can see that there's this rash. So there's a primary body rash, and it's usually on the soles of the feet and the hands. That can also be accompanied with headaches, swollen lymph nodes, fatigue, aching joints, fever, weight loss, hair loss, and the syphilic epididymis. This is where it's damaging and swelling the reproductive system. So that's when directly in males that it's doing this. In females, we'll talk about kind of the effects that happens later. So this is the second stage. The third stage is actually the latent stage. So in this stage, everything kind of goes away. So you can see how in the picture it depicts this perfect woman. You don't see anything, but when we're looking closer, you can see that the bacteria is still in there. All the signs and symptoms have gone away, but it's still like in the body, just in a dormant stage. And this can last from a couple years to 10 to 20 years. So in the tertiary stage, this is the last stage. And so what happens here is 15 to 30% of people who go untreated actually go into this stage. And like we said, it happens about 10 to 20 years after the first contact. And so these are our really severe cases. So the signs are tumors, paralysis, blindness, damage to the brain and other organs. And then the symptoms are you can have difficulty coordinating muscle movements, numbness, gradual blindness, dementia, stroke symptoms, seizures, headache, stiffening, fever, and brain. And so this is damaging your blood vessels, bones, eyes, heart, joints, and the damage can't be undone once treatment is started. We can stop the bacteria and the infection in the body, but once the damage is done, it's done. So going on further into the tertiary stage, so these are like really severe. So you can see kind of the ulcers in the bottom right corner that has gone into some of the systems, the skull damage actually that it's caused, and then here's in the top right is a brain. And so in this brain, it's created those holes. So it can have cardiovascular effects. So this is affecting all of our valves and our heart systems. And then the late neurological complication, this is the paralysis, denature of the nerves that carry to the sensory information. So it's just breaking down and messing up our nerves. And then there's the grammatosis. So these are the lesions. And this is the like holes in the brain and the spinal cord. And then in the late benign syphilis, again, those are those gamma lesions in the skin, bones, soft, and just throughout all your organs. So the soft tissues and throughout the organs. So the next slide we're going to go over is actually the effects that it has on little babies. So this is a congenital syphilis. So if mom is a positive carrier for syphilis and has not been treated, then it's going to go into the baby. So it can have complications in the mama with the placenta and the umbilical cord. It actually causes such swelling that the placenta can rupture and the umbilical cord isn't giving nutrients to the baby anymore. So in moms, we see a lot of miscarriages and the premature birth. So looking at the babies, it's going to cause jaundice. So the liver is not really able to kind of filter out some of those blood. And so it just is leaving these toxins in the body. And then also the hepatoma spleen malady, again, kind of runs along the line with the jaundice. It's where the spleen is just not cleaning the blood and it's just creating a toxic inner environment in the body for the baby. We can also see the rashes on the mouth, the genitals, anus, and bottom of the feet and hands. And actually this picture is showing kind of those rashes and lesions on that baby. If untreated, the baby will have a runny nose, a saddle nose where actually kind of the inside of the nose is hollow, and Hutchinson's teeth. So these teeth are very different and will appear differently throughout their life, and you can't get that back. So there's also saber shin, which is the shins actually developing in a way that isn't beneficial, so they're bone malformations, and then vision and hearing problems, seizures, and leg arm paralysis. So a baby isn't developing if they can't move their arms and legs, so that's really an issue. So some other symptoms are the fetal growth restriction. So this baby is just not growing in mama anymore because it's not getting nutrients. So it's a very small baby. They could actually die, and the liver and spleen problems, and the edema, again, it's just the blood isn't being able to produce what the baby needs. And then meningitis. So that's the swelling of the brain. And the next slide we're going to look over, it's just kind of an overview of what these stages are going through. And again, only about 28% of these people with syphilis actually go into the tertiary stage. So next we're going to talk about the pathogen and the viral or the virulence factor. So in the picture you can see how it's going to enter the body and then what the response of the immune system is actually going to be. So it's going to enter that body through the small breaks in the skin, and it's going to actually invade the immune system. So it's going to go kind of under the radar for a while. And when our body does produce the antibodies, it's not really going to do anything. So it's going to enter the body, into the bloodstreams. And they're not really sure how it's attaching to the cells, but then it's going to go deep into the tissues and the organs. And actually, when studied on rabbits, it entered the lymph nodes within hours, and then within a matter of 24 hours, it was actually down deep into our deep tissues of our body. So it does partake in the chemotaxis, which is where the cell sends off chemical reaction to see where the best environment would be. And then it again is affecting the dendritic cells and the endophthalmic cells. So these are our muscle cells and then our nerve cells. And then it's causing inflammation, but it's interesting because it lacks the lipocyte cells, which also is what traditionally causes that. So this is just a really unique bacteria that we're still studying and learning a lot about. So in the pathogenesis, there's 1,138,006 base pairs, so these are genetics, and about 1,041 predicted coding sequences. So it actually has a relatively small genome, and then it actually uses the host biosynthesis to kind of figure out what it's doing. So this bacteria in particular can't produce enzymes, cofactors, fatty acids, nucleotides, and the conversion of the pyruvate to the aspartate. So it really depends on their host cells. So it's mainly made up of the transport proteins, which is kind of hijacking the cell to get it to do everything it needs to do, and it's using carbohydrates for the energy. So it's encoding the proteins and the poron and the adhesions in those cell walls to figure out and to do kind of manipulate that host cell to get what it wants. So they're still unsure about how the neuroinvasion is happening and how the congenital transmission, so into those babies. That is partaking in the gene conversion, which is then undergoing the surveillance of the immune system. So the immune system really isn't seeing it until it's too late. And an interesting factor with the syphilis is it actually facilitates the HIV infection and progression. So it kind of goes hand in hand. So this here on the right is a picture of actually the bacteria of the syphilis. So looking at the epidemiology, Okay, so here you can see in this picture how it's really affecting those impoverished third world countries, and how it still is affecting the developing countries, but it's still just really targeting them. So it is an infection disease that has been around since biblical times, so it's been around for a very long time. And Christopher Columbus, it all shows those things and this disease. And it only affects humans, which is super interesting. It's transmitted as an STD. It can go bloodborne, and it can be congenital. So bloodborne, we're mainly focusing on IV drug users. Globally, it's targeting groups with limited resources. So those developing countries, they don't have access to health care. It's actually the leading cause of perinatal and neonatal death in the developing countries. So in industrial countries, it's usually targeting people in poverty, men having sex with men, and then the IV drug users. And again, it increases your chance of HIV. So to diagnose syphilis, first we are going to clinically, see the symptoms, and they're going to likely diagnose it at that point in time. You're going to have the rash, headaches, fatigue, and then they will do a blood test. So they'll just draw blood and see if you have the antibodies. So you can be diagnosed if you currently have syphilis, or if in the past you've had syphilis, because it will see those antibodies. If we're having neurological deficits, then they're going to go and do the spinal tap and get the fluid out of there to see if it's affecting. So treatment actually for syphilis is it's just penicillin. So penicillin is incredibly effective. You can take it orally if it's so it is a gram negative, so it's going to break down the cell wall. If you're allergic to penicillin, there's also alternative options of the dicycline and the tetracycline. If it is too far and you are showing too many symptoms and it's really hurting your body, they are going to do it through the IV. If you're pregnant, you can only take penicillin, so you're going to have to go through a desensitization process. So after treatment, there is some follow-up that you need to do. So you need to be teaming with those doctors and having open conversations. You need to have periodic blood tests that are going to be happening to see if the treatment that they're using is working, or if they need to increase the dose of the penicillin. You're going to want to avoid sexual contact with any partners, notify any past sexual partners, and then they also want to test you for HIV because it is such a big deal. So prevention, when we look at prevention, we can always, use the good hygiene, which is in the third world countries, protection during sex, being screened regularly for STDs, not sharing needles if you're an IV drug user. And actually, in the past, they have done mass doses of penicillin for the third world countries because it's easier to give penicillin to all versus missing and the devastating effects that syphilis actually causes. So what syphilis actually looks like is it's going to be that spirillite, which is coming. So it's going to be the spirillite. It's going to be fairly small. It can actually only be seen under the dark field microscope. So when we're using our regular microscope, it's not catching it, that we've used in class. It actually has the pointed ends, and it lacks kind of that hook shape, and it uses the corkscrew for motility. And you can see in these pictures the tip of the structures, how it uses for the movement, the outer membrane, how small it is. Okay, and last, here are my references for everything that I've researched. There's a lot of really great references out there, and a lot of good information on syphilis, actually. Okay, thank you and have such a great day.